Hi, you're welcome to Facts of Health again. If you just tuned in, this is GNTV and we are live on air. This is Facts of Health. I am Na Edu. We've had two previous episodes, and if you missed them, I'll give you a recap of the two previous episodes so that you can join us and continue from now. In our first episode, we discussed sickling negative and its negatives. I know you think it's a weird topic, but it is true that when you test sickling and you are negative, you think you're fine. We found out that ACs can test negative and then they can still produce sickle cell children. And then we also went on to talk about sickling disorder. So we talked about sickle cell disorder, and then we talked about the variants that are there. It is here that by the WHO, World Health Organization, in 1990 declared sickle cell as a public health issue. And it's true. In statistics, we find out that 1 out of 4 Ghanaians have traits, which is also part of sickle cell disorder. We have the traits, we have the sickle cell disease, those with the SC, SF, SD, SJ, and then thalassemia. And then we also realize that we have sickle cell anemia, where you have the SS. We've also found out that as traits, you can't marry each other. AS can't marry AC, AS can't marry AS, SS can't marry SS. So it is best, instead of going for sickling test, you rather go in to do your electrophoresis so that you find out what genotype you carry. You can join us today as we discuss complications and management of sickle cell disease. If you have children who have sickle cell, you can tune in and then listen to how you can manage them. If you're a sickle cell patient, tune in and then also listen to us. You can call any other friend who you think is having issues with sickle cell disease to also tune in. The traits can also join. Family, children, and everyone. You can be part of the show by sending your WhatsApp messages through 050-143-2820. My address is by Biama Clothing. You can call on 020-8499-671. My makeup and hair is done by Penis Experience. You can call on 054-183-2737. You can join us on all our social media handles: Facebook, Facts of Health; Instagram, facts.of.health; at Twitter, Facts of Health 1. Facts with a spelling capital F, capital O, and capital H. You can also subscribe to our YouTube channel, Facts of Health, and join us there. We are streaming live on GNTV Ghana Network. You can search for us on Facebook. Stay tuned. I am Na Edu. Health. I am Na Edu, your host. I have two beautiful ladies here. They were here last week and they are here today to help us with complications and management in sickle cell. I have Dr. Grace Amu from the Ghana Institute of Clinical Genetics, Sickle Cell Clinic, Kolebu, and Mrs. Esther Tobo, a nurse tutor from the Public Health Nurse School, Kolebu. Ladies, you are welcome once again.
Thank you.
Last week was fun. I'm sure my viewers enjoyed you. And then I've brought you back today. Last week we did sickle cell disorder, so a lot of questions came in. It seems a lot of issues about management, a lot of questions about management came in. And then I decided that we'll go in for complications and management in sickle cell. But you're looking beautiful, Dr. Amu.
Thank you.
And Auntie Esther, I love your hair.
Thank you.
We have juice here, colorful juice provided by Juan Diva. You can call on 027 266 3611 for all your occasions. She has mocktails, cocktails, all fruit juices, and she'll set up for you. You can enjoy the juice. And I feel nice. All right. How's the weekend?
Good by grace.
Oh, yours is looking very good because I could see it from your hair. I can see it from your hair, and then the colorful, and then Dr. Amu with her pink. She's also looking great.
Thank you.
We'll go straight to our topic: complications and management in sickle cell. Dr. Amu, what are the chances? What are the most prominent complications a sickle cell patient is supposed to have?
Okay, I want to take this opportunity to greet you.
All right.
Thank you, Na. Okay, so we can look at the complications of sickle cell from various angles. I mean, usually the sickle cell patient is stable, but then when is faced with a trigger, then they might enter into acute complication, which is called crisis.
Okay.
So there's that aspect of it. Then also they tend to have chronic complications. And then there are some, based on the type, the variant, they can also have some peculiar features which also results, which is also a complication of the condition.
Okay.
Last week we established that sickle cell disease is due to a defect in a gene that codes for hemoglobin. Hemoglobin, we said, is the red pigment, red color in the red blood cell. So the underlying pathology is that because of this genetic defect, the red blood cell red blood cell in a person with sickle cell disease is slightly different from the normal red blood cell, which we said is the AA red blood cell. So with a normal red blood cell, we established that it has a spherical, or it appears like the ring.
I think we have a slide to show that type.
So we said that it appears like a ring donut. It's very flexible, and then it's able to move freely through the. Can we have the slide?
Okay.
And it's able to move freely through the vessel, but then it also has the lifespan of it is about 90 to 120 days. But then when we look at the sickle cell, we said that during any oxidative stress or anything that takes out oxygen from the cell, the hemoglobin will crumple, and then once it crumples, it causes the red blood cell to also assume what we describe as a banana shape, or the half moon, or what we call the sickle shape.
I think we can have our first slide. So our first slide is there.
Yes, so I think the slide is showing the normal red blood cell and the sickle cell. Now the pathology here, what actually happens is that the sickle shape is rigid, and it's not as flexible as the normal cell, and so they tend to clamp together. Now as they clamp together, they then tend to occlude blood vessels, and then so everywhere there is blood vessel, sickle cell, this complication is called a vaso-occlusive crisis. And in other words, blood vessels has been occluded. So vaso-occlusive crisis.
Okay.
Vaso-occlusive crisis can occur anywhere from the head to the toe, everywhere there is blood vessel. I want to show the second slide.
Okay. Can we have a second slide, please?
So depending on where the occlusion occurs, this picture is showing a little child with swollen hand and foot. This is what we call the hand-foot syndrome. And it's usually the first sign of sickle cell in, especially those with the SS variant. So for those with the SS variant, usually after 6 months. Now, why 6 months? When a baby is within the womb, usually it produces, and the body produces a different variant of hemoglobin called hemoglobin F. The hemoglobin F tends to be protective, and so when it absorbs oxygen better, it holds on better to oxygen. So that does not sickle. So even when a child has sickle cell disease, within the first 6 months of after delivery, the child may not show the crisis or the symptoms of sickle cell disease because there is still some element of this fetal hemoglobin. But then after the 6 months, the normal, let's call it adult hemoglobin then starts kicks in. And then that is when the sickling or the acute crisis is seen.
Let me cut you a bit. I know you have a list of complications, but I want to bring in Auntie Esther. So does it mean every baby that shows these signs is sickle cell?
Yes. Yes, because most of the time with the mothers, some of the mothers will tell you that my child has never been sick. I've never taken the child to the hospital. But this is what is happening to the child. So if you are a mother and then your child starts exhibiting some of these signs and symptoms, you have to get worried. So the best thing is to take the child to the hospital so that the necessary labs can be run. So that we will know the type or the genotype of the child, so that the necessary care can be given to the child, rather than you keeping the child at home and then it will turn into something else.
All right. Dr. Amu, if you can continue with your complications, the list of complications.
So we are talking about a vaso-occlusive crisis. So we are saying that it can occur. The commonest site that patients would experience vaso-occlusive crisis in the long bone. So they feel pain. They call it bone pain. It occurs in the bones, in the leg, in the chest. So they can have chest pain. When it occurs in the sternum, it can occur at the vertebra. So then they will have back pain. Even in the head, it can give them headache. Even in the jaw. So depending on where the vaso-occlusive crisis is occurring, apart from the bones, it can also occur in some organs, like the spleen. The spleen is an organ just below the stomach, and then its role is to help the body to fight infection. So that as they keep on getting recurrent crisis, sometimes they are prone to infection because they lose the function of the spleen. Vaso-occlusive crisis can occur in the brain, that can cause stroke. Virtually every organ.
Wow. This is
so that's the first crisis I wanted to talk about. The next common crisis they experience is what we call the hemolytic crisis. Remember we said the red blood cell has hemoglobin. So hemolytic crisis means that the red blood cells are breaking down. Want to show the next picture how to tell when a sickle cell patient is experiencing hemolytic crisis.
So can we please have our next slide, please?
So with the hemolytic crisis, the blood cells are actually breaking down. I think the last time we talked about the structure of the hemoglobin. It has protein, which is the globin.
I think the slide is there.
All right, thank you. So it has protein, which is the globin, and then the heme, which is iron. So iron containing ring. Now when the hemoglobin breaks down.
That sounds good though. Hemoglobin.
Yes.
And Okay.
Yes. So when the hemoglobin is breaking down, the heme aspect is separating from the protein aspect. The protein aspect is broken down, so it's reused by the body into. It's broken down into amino acids, so it's reused by the body.
Okay.
The heme part gives the iron, and then bilirubin. Eventually, would give bilirubin, and so whenever the bilirubin is excess in the body, then it shows as jaundice, as you can see.
Oh.
So yellowing of the eye.
Okay.
There are several things that can cause jaundice.
Jaundice. Yeah.
But then blood cells breaking down causes jaundice too. I mean, you could also have jaundice when you have a liver problem. So you don't go about looking at people and saying you have yellow eyes, so you have sickle cell disease.
Yes.
Yeah. Then again, when a patient is, we are talking about the acute crisis. So acutely, when somebody is hemolyzing or having hemolytic crisis, you have jaundice. Then again, you would notice that the urine would be dark. When you take a look at how the different shades of
the urine.
Yes, take a.
So can we have our next slide, please?
So the urine also. So as when you see this, then you should know that the patient is undergoing an acute hemolytic crisis and needs to be attended to immediately.
Okay.
Okay. So these are different shades of the urine.
All right.
So the normal urine should be from the right side, but then the ones here are very dark. Once you see this one, it shows that the patient the blood cells are breaking down.
Wow.
When this happens, it means that the patient is going to have anemia. And we've mentioned the function of the hemoglobin. It transports oxygen around. So it means that there's going to be a deficit in the transportation of oxygen around the body.
Doctor, can I break in a bit here?
Please.
Auntie Esther, she's saying that this kind of urine, the colors can show that you are getting into an anemic. Doesn't mean that everyone, because most of us, we can short blood at any point in time. Even someone who has hemoglobin AA can short blood. So are you going to have the same color as someone who is sickle cell?
From what Dr. Amu said, it can also be maybe another thing.
Okay.
Not that the person has sickle cell.
All right.
Maybe it may be another condition. For instance, the yellowish eye that she said, you can't just go and see the patient is sickle cell because he has yellowish eyes. Maybe he has a problem with the liver or something else.
All right.
So with the urine too, maybe the patient is suffering from, maybe there's blood in urine, another condition. So you can't say that because it is the urine have started changing. This patient is sickle cell, so you have to come to sickle cell clinic. No, it's maybe something else.
It may be something
Yes,
else.
but we are more concerned about our patients, who are the sickle cell patients. When their urine color starts changing,
Then what do they do?
then she hasn't finished. So let's end.
All right.
All right. So basically, the dark urine means that the blood cells are breaking down.
Okay.
So it doesn't really matter the cause. So there are several causes of blood cells breaking down. But then, when you see this, it's very important to recognize this, because sometimes some patients will come to the clinic, they saw that their urine was dark, and then you are like, when did this happen? It's like, oh, 1 week ago. Because
1 week.
Because this problem can progress to cause a problem with your kidneys, acute kidney failure.
Okay.
So it's necessary when you are home, when you are seeing this, to take in a lot of water and then get to the hospital for the appropriate interventions to be put in place.
All right.
I think I had a picture of anemia also, if you can.
Okay.
So,
So can we please have our next slide? Today we are in school. and I know you are enjoying the discussion. This is still Facts of Health. I am Na Edu, your host. And then you can be part of the show by calling 050-1432-820. WhatsApp, please. WhatsApp, please. So 050-1432-820. You can send your messages, your